Back to our innovative discovery series. We are resuming the series after several months of interruption due to the COVID surge in January and February. And I'm extremely excited today because it is a presentation that we've been looking for several months. We have two speakers, Dr. Minnkyong Lee and Dr. Hiral Master, who will present the All of Us research program, an extraordinary and forward-thinking initiative funded by NIH. But before I introduce our speakers, let me go over some housekeeping issues. So as usual, we continue to extend CME credits both for our Tech Talks and our ID series. We will distribute the information via email to those that registered for today's event, but if you did not register prior to today's talk, you can still obtain CME code information from Deborah Rees, and her email is in the chat. Our upcoming events on April 28th, Dr. Anne-Marie Brescia from Nemours will talk about the prognosis in juvenile idiopathic arthritis. And on May 12th, we have another ID series with Dr. Craig Pollack from Johns Hopkins, who will talk about housing policy as a tool to improve health equity. So you really do not want to miss also these two very exciting presentations. So I'm really delighted to introduce our two speakers. Dr. Minnkyong Lee is a program officer working in the NIH Office of the Director section for the All of Us research program in the Division of Engagement and Outreach. She has been working for All of Us since 2017, and in addition to being program officer, she is also lead of the Engagement and Retention Group and of the Genetic Return of Results team, as well as a co-lead of the Researcher Diversity team. She obtained a PhD in Biomedical Sciences and Molecular Endocrinology from Rutgers University. Dr. Master has been a scientific project manager for the All of Us research program in the Data and Research Center at Vanderbilt University since 2021, so very recently. For All of Us in the Data Research Center, she focuses on initiatives related to digital health data and outreach activities within educational and research settings. She obtained her PhD in biomechanics and movement sciences with a focus on clinical and translational research from our own University of Delaware. She has a Master in Public Health with a concentration in biostatistics from University of North Texas Health Sciences Center in Fort Worth, and a Master in Physiotherapy from Rajiv Gandhi University of Health Sciences in India. So we are, again, extremely excited to have these two wonderful speakers. But just a quick note before we start. The All of Us program provides a very rich data resource that is available now to all ACCEL CTR and Delaware researchers, because all our CTR institutions have completed the data use agreement with Vanderbilt. So listen carefully, and hopefully you'll be able to access this data.
Thank you so much for that great introduction. And it's so great to hear that all of your institutions have a data use agreement. That's usually one of the biggest steps to getting on the workbench. So after that, it should be quite easy. And we hope today's presentation is of help in navigating your way onto the workbench and using the data. It's really wonderful to be here today. Good afternoon to everyone. We're excited to share some of our work with you, and many thanks to the hosts for organizing this event. We had been waiting since February, and we know that with the ongoing pandemic, each of you were very busy. So thank you to each of your efforts in keeping your communities healthy during this ongoing pandemic. And we will jump right into our presentation. So we are here to, again, explore the All of Us research program with you. And next slide, please. We'd like to share the mission and objectives of our program, and also Dr. Master will talk you through the Research Hub and the Workbench and how to access its data and tools and the surveys. And then at the end, we hope we have time to hear from you as well. And first most, we always like to thank our participants and community partners at the beginning of our presentations. They really work hard, our community partners. Many of them are shown here. to engage their communities and networks, and our participants across the country who make our program possible by donating their time and biosamples. Thank you to all of them. And again, on our next slide, also many thanks to our consortium partners. Our consortium partners are the ones who manage the various aspects of our program, from enrollment to biospecimen collection, data management, and beyond. Our community partners and enrollment partners have really been central to the efforts of building the diverse cohort that we have today. And if you squint really closely, you might be able to recognize some of the institutions here as well. Next slide. I realize that some of you may be familiar with the All of Us research program already. I don't know if we can do little reaction buttons here, but please feel free to put a word in the chat if you have heard of us before prior to today. I'd like to review some aspects of the program that really makes us unique. As you may have heard, diversity is at the core of our work. We are working hard to build a cohort of 1 million or more individuals from all walks of life, with an emphasis on including communities that have historically been underrepresented or even excluded in biomedical research. And you may see that today abbreviated as UBR populations, and participation in the program is open to all. We are building this diverse community with a focus on participants as partners. And this means that All of Us includes participant representatives in every level of our program, including our governance structure. So there are different committees that include participant representatives, and this is rarely done in other longitudinal studies. We aim to understand health, including healthy aging and wellness, which means including time as a factor. So that leads to the longitudinal nature of our program of spanning 10 years or more. And we also have multiple data types available to learn about the intersection of different variables on health and disease. In addition to collecting electronic health records, we also follow up with participants through new surveys, opportunities to share wearable device data like Fitbit, and also we hope to provide opportunities to donate new biospecimens as well. Our research hub, which Dr. Master will review today, is aimed at providing a national open resource with diverse data available to all researchers of all career levels. And last but not least, we are partnering with industry leaders and applying the latest technology measures to ensure security and privacy of the participants' data. And while this is the last item listed here, privacy and security is really our top priority in every single decision that the program makes. So what is our program really focused on doing? Our mission, noted at the top here, is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. And we go about achieving this ambitious mission through 4 foundational objectives. First, we're nurturing relationships with the 1 million or more individuals that we aim to enroll. And we're delivering one of the largest, richest biomedical data sets ever. And in doing so, we hope to catalyze an ecosystem of communities, researchers, and funders who will make All of Us an indispensable part of health research. And we're doing all of this through a team that maintains a culture built on some of the core values that I covered in the previous slide. Next slide, please. So how do we begin collecting all the data for this grand data set? It really all begins with our participants. And we have a core protocol where first it entails that to become an All of Us participant, you create an account online, and then you complete consents and health surveys where you provide some basic information about your health, lifestyle, some medical history. And then after that, some participants will be invited to donate their biospecimens, and also they'll have their physical measurements recorded, like your height, weight, and blood pressure. And then, being a longitudinal study with the goal to last for at least 10 years, the program will continue to follow up and reach out to participants through updated surveys and other ways to participate. And all of this data is then curated and made available on our researcher workbench. We currently have data from more than 329,000 participants who have completed the initial steps of the program, which were just described in the previous slide, including completion of various surveys. And 80% of these participants are from historically underrepresented communities, and 50% are self-identified as racial and ethnic minorities, which makes our data set one of the most diverse data sets available. We have physical measurements available from more than 267,000 participants, and we have EHR data available from more than 214,000 participants. And most recently, which many researchers were excited about, we've added whole genome sequencing data and genotyping array data in our control tier, which will be reviewed shortly. So with this diverse open data platform, the All of Us research program is really aiming to enable research on many aspects of health, and doing so without a single biomedical research question in mind. And rather, our framework focuses on wellness, reduction of health disparities, improved risk assessment, and earlier and more accurate diagnoses, hoping to improve overall health outcomes. And the key word here is enable. And we really look to researchers like yourselves to perform the research, because our program won't be actually performing the research itself. We look to you to analyze our data and make new discoveries that may have not been possible before with other data sets that were perhaps not as inclusive or as diverse as the All of Us data set. And therefore, by the very nature of our program, we hope to promote innovative and impactful research that will help drive more precise approaches to care. As we continue to build this data platform with our researcher community, we want to also ensure that as our researcher cohort grows, it is as diverse as our participant cohort. We want to engage diverse communities not only as participants, but as researchers who are on our data platform, bringing their diverse perspectives informed by their broad range of expertise and experiences, and also because research has shown that teams that are inclusive of these diverse perspectives are more likely to produce impactful studies. The program is truly committed to increasing diversity in researchers on the workbench in terms of demographics, career level, and institution type. Research has shown that a demographically diverse researcher cohort will generate outcomes that return the greatest value to our participant communities, especially to those who are from those historically underrepresented communities. And encouraging students and early career investigators will bring, again, diverse perspectives and also help propel their careers. And having researchers from diverse institutions will help build an equitable resource with diversity being ensured on both sides of research at all levels. And next, I will hand it over to my colleague, Dr. Hiral Master, who will provide an overview on the Research Hub.
Hiral, you are muted. Hiral, I'm sorry, you are muted.
Okay, can you hear me now? I'm so sorry.
Yes, yes.
Sorry. So thank you, Dr. Lee, for providing this amazing background on the All of Us research mission. What I've tried to do in this presentation is to dive deep into our data structures and data pipelines. And I've been joined by some amazing colleagues from DRC. So if you have any questions as I go on with my presentation, please write it in the comments section, and then my colleagues will help answer those questions. Okay, so as Dr. Lee mentioned, we do this amazing data collection from various resources once the participants are consented. So once participants consent and they give us the data, then basically this data is been given to us, that is at DRC, and it's been given to us as raw data repository. Once we get the data, we basically then curate the data. What I mean by curation is like we would harmonize the data, we would make sure that privacy principles are applied. That means we would de-identify the data, we would quality check the data, and once the data meets our the standards, then we would give this data on a secure cloud-based platform. So how do we give this data? So we want to give the data to everyone, but we also want to make sure that as we give data to everyone, we give them wisely. So we want to have a good balance between giving a wide access, but also making sure that participants' data is safe. Like, because for us, privacy is first, and we are making sure that we build an ecosystem where the trust of participants is always maintained, and they are our key stakeholders. So I would like to go deeper dive in onto how you can access our data. So we provide data and our resource in a tiered format. So it's like a passport model. So what happens is we have a public tier where you can get the summary counts or aggregated counts of different data types on our website. So, and that is available to everyone, like anyone can get that data. Second, we have register tier. Third, we have control tier. And I'll be discussing what is the difference between register and control tier in my next slide. And lastly, we also have another tier where you can get individual biospecimen. However, that tier is right now not currently available to researchers. So I would not go deep dive into the last tier. So what is the difference between registered and control tier? So in the registered tier, you can get access to individual row level data. So you can access survey data, EHR data, Fitbit data, physical measurements data, which is like row level data. And in a control tier, you would be able to access still the same data. However, you can also access genomics data, and we also have like lesser privacy rules. So what I mean by that is we would have data which is not date shifted. So you would actually see Fitbit data in real time, like what is the trend of Fitbit over the years that participant wears. So that's like a key difference. And again, depending on your research question, you can either use register tier data or control tier data to answer the questions. So let's dive in deep into our first tier, which is our researcher hub. So again, this is like a public tier. Again, this can be accessed by anyone, like anyone, be it anywhere. So as I said, and one key thing is this public tier is free and anyone can access, and it is like a home. So I would encourage each one of y'all to explore like a public tier by going onto this website, that is www.researchallofus.org. On this public tier, I would want to first highlight my top 3 favorite tools. So again, these are my top 3 favorite tools. I'll go deep dive into my top 3 favorite tools. That is Data Browser, Survey Explorer, and Research Projects Directory. So what is Data Browser? So Data Browser is basically an amazing go-to place that you can actually type in and see how many data is available. So like it will give you a sense whether this All of Us program data set is actually feasible for your research or not. So for instance, let's say if my interest is to study patients with diabetes. So what I would do is I would simply type diabetes, and then it would basically filter out and then say, let's say, how many data types are actually available that matches your condition called diabetes in this case. And as I said, like we have data, so I'm going to explore the EHR data. So if you click on EHR and if you click on condition, then you can actually see, okay, there are so many data that relates to diabetes in the EHR data. And you can see I've highlighted type 2 diabetes. So you can actually see the SNOMED code, the OMAP concept ID, what is used to basically extract this type 2 diabetes data. And you can also see all the counts, so like how many participants are there, and also how many participants are female or male at birth, and also the age distribution. Again, remember this is summary data, so you would not be able to access row level data. It is only summary count data. Once you so this is like my favorite tool. Now, second favorite tool is the Survey Explorer. Again, All of Us research program, they collect a lot of surveys, and again, you can get an overview of what surveys have been collected. There is an English version as well as Spanish version available on the website, and you can dive in deep. I want to point out that in response to COVID pandemic, All of Us research program actually initiated COVID-19 participant experience survey. So we have a COPE survey. So if you guys want to do any specific research which relates to COVID pandemic, we do have some data types available that can help you in your research. Next is the research project directory. The reason I like this tool a lot is because this is a site which is useful not only to researchers but also to participants. This site will tell all the stuff, all the research that is happening using all of us research data. So if participants wants to know what's happening with their data, they can go to this research project directory website and they can see what's happening with their data. In that way, we want to ensure transparency. We want to make sure that there's no stigmatization research going on using all of us research data. So this is an amazing tool. And as a researcher, it's going to be helpful to you. So let's say if you're interested in doing diabetes research, you can definitely type in by diabetes and project title, and you can see the list of projects that are actually going on in patients with diabetes. And you can get a sense of flavor of, okay, what is happening with the diabetes research. Additionally, you can also see who is leading that specific project, and you would be able to see what is the purpose, what are the anticipated findings. You would be able to get a gist of like the research that's going on. There are some other tools that, again, I won't go in deep because of the time constraints, but there are other tools that I would really encourage you all to use. One is data snapshots. The data snapshots actually tells like how many participants till date are being recruited to all of us program, which is like, if you see, we are at 484,000 participants. So almost halfway through our enrollment target of 1 million participants. And we have publication page, spotlights page, which tells you what's going on, the productivity using the all of us data set. And we also have a separate like a page on COVID-19 initiatives if you want to do any COVID related research. I hope that has really excited you all and you want to now explore row level data. But before we go on, and I can tell you how you guys can explore row level data, each one of y'all have to become a registered user. So I just want to quickly walk you through how you can become a registered user. So if you go to this researchallofus.org, there is an icon called apply. Click on that icon, apply, and then the 6 steps will pop up. Good news, given you have already you're attending this presentation, you guys have completed step 1. But again, I would encourage you all to keep exploring more on the public facing website. Please continue exploring more. Second is you check your institution agreement status. As mentioned at the start of presentation, everyone, like all the institutions in deliver CTSR, they have the DURA agreement in place. So you don't have to worry about it. You guys have already completed step 2. All that is remaining is to complete step 3 to 6. And you guys can complete steps 3 to 6 in simply 1 to 2 hours. You can do it either in one sitting or you can do it at multiple sittings. Like you would always be able to save your work and keep going. It's this, as I said, this is a cloud-based platform, so everything is saved and you can pick up your training, you can pick up whatever you have left in your registration process, and you can start from there. Once you finish this, so you have to then sign, like once you finish all your research training, you sign your data use code agreement, you are all set. You can now simply then access the row level data. So how you would able to access, again, one thing I want to highlight is in any, during the registration phase, if you guys need any assistance or if you guys need any help, there's a help icon at the bottom of our website. You can click on that and you can then submit your question. Again, our support team is super awesome and they normally reply to your queries in like 1 to 2 business days. So if you guys have any questions during the registration process, feel free to submit that login.gov registration assistant form. You can and feel free to ask us any question. Also, if you have any question with your data set or something, feel free, you can ask us any questions and our support team will answer those questions in 1 to 2 business days. Now, assuming you guys have completed your registration step and you guys have become registered user, I just want to quickly go over how you guys can access and analyze this row level data. I just want to give you guys a flavor of our, of our researcher workbench, which is a secure cloud-based platform. Given it is very unique to execute the research, but I want to highlight like how this platform can actually serve as an amazing place to do team science. So as you go to our public website, that is research.allofus.org, that is like a researcher login. When you click on researcher login, a separate page will pop up which will tell you to sign in into your researcher workbench account. It's simply like how you sign into your Gmail account. It's simply like that. It's super simple process once you finish your registration process. Once you log in, this is how the landing page would look like. Again, in this landing page, I want to highlight we have quick tools and videos, which are simply like 2 to 3 minutes videos. If you ever want to like have an understanding of what this platform is, what is this tool, like if you have any questions, you can always come back to this quick tools and videos, and you can like learn more about our platform in just 2 to 3 minutes. Then first thing, in order to access this row level data, is for you to create a workspace. As I mentioned, creating workspace is very, very important because the workspace that you will create will pop up onto a research project directory website. And this is very important, and we encourage you all to provide as much details as necessary so it can be shared not only with our researchers but also with our participants. Again, one thing that I want to highlight, it's not like you finish this workspace that's like all in all done. Given it's a cloud platform, you can edit this workspaces anytime during your research journey, because we understand, science is innovative and you might have to change your methods halfway through. You might think that, okay, survival analysis may not be the right way. I have to go through some other analysis. You can change the content of your workspaces anytime. It's not like it's only one time. You can change it anytime during the process. Once you do that, you can then share this workspace. I want to highlight like some key features. You can share this workspace with any people on your team. They only have to be a registered users. So our workspace is highly, highly collaborative. So what I mean by collaborative is there is a share icon. So like you can, once you click the share icon, you can then share it. Let's say if you want to share it with your with your mentor or with your undergrad student or with your graduate, with a fellow PhD student who is working together on this research project, you can simply share the workspace with them and you can give them different level of access options. So what happens is there are different level of access. Some can be owner, some can be reader, some can be writer, depending on what their role is on the project. One thing to remember is you can share these workspaces to anyone. It doesn't have to be from University of Delaware. You can share it to someone at Vanderbilt University Medical Center. You can share it to someone in California. You can share it with any researcher. They only have to be a registered user and you can share it. So let's say if you're doing a research and if you feel that coding is not your best suit and you want to share your workspace with some programmer who is a registered user, you can basically share your workspace with that person and give them a writer access option. Now that the workspace has been built, everything, you have set up your team, I want to now highlight some point and click tools that is available for you guys to explore. And these point and click tools doesn't require any programming language. Is as simple as, like clicking an icon and then playing around with it. So first I want to highlight is the cohort builder tool. So the cohort builder tool, as you see like on a landing page, you will have a cohort. Just click on the plus icon. And when you click on the plus icon, you can then add the number of criteria that is available. So like whenever one needs to do research, they would have set number of inclusion and exclusion criteria. You can add any number of inclusion and exclusion criteria into this cohort builder tool. Also, if you have criteria which has time component, we can also include a criteria which is like longitudinal in nature by clicking on temporal. So let's say I want to see if a participant is having a drug use in past 30 days. You can basically even add such detailed criteria too. Once you are happy with your criteria, inclusion, exclusion criteria, you would then be able to see how many participants, like what your analytical sample size would look like, along with the distribution by age, gender identity, race. I think this is an amazing first step because it will give you a flavor of what the data set looks like even before going deep in and exploring or doing any kind of analysis. And this is completely free. Like there's no money charged to it. You only have to be a registered user and create a workspace. This is completely free to do it. Second is having like a data set builder tool. So the data set builder tool is like, we are now creating your analytical data set. So it's kind of like number of columns you need. So so what you can do is, okay, I need demographics. So I need gender, I need age, I need race in my column. Then let's say I need Fitbit data. So then you can also click that, okay, I need Fitbit heart rate summary data. I need Fitbit steps per day data. You can click on any number of columns that you are interested, and you can also create your own concept sets. So again, these columns that you would be adding, these are nothing but they are concept sets. So you can add any number of concept sets. Once you add those concept sets and you select the values, what happens is you can then preview your data set. This is like kind of like how you preview your data set in any analytical platform. Like it's like you can preview a table. Okay, so this is row 1, participant ID 111 has this much, like this is their gender, this is their race, this is their age. You can see the entire data table in preview data set. Once you're happy with all the criteria, I'm like, oh, this looks amazing. This is what I want. This is how I want my analytical data set to look like. You can then click on create data set. And when you create data set, you can then go in and dive in deeper, doing all kind of analysis that you want. There's no restriction. Sky is the limit. You can do any kind of analysis. Machine learning, inferential analysis, descriptive statistics, any kind of analysis you guys want to do onto our Jupyter notebooks. So right now, since we want to keep everything on a cloud platform, because we feel that that is the most sustainable way to manage such a large resource, and as we keep on giving more data types. So that's why we want all the users to conduct all the analysis onto our Jupyter notebooks, which is again a cloud-based platform. And right now, the Jupyter notebooks supports R and Python coding languages. And you can create, you can explore the data, like you can see how many participants are there with multiple data types. You can explore and you can write any number of code you want to write, or if you have a programmer who wants to help you with the coding, you can share it and he or she can write whatever codes you guys want to do. Like you want to do like virtual twins analysis, you guys want to do like forest plots or like random forest analysis, any analysis that you guys want to do, you can basically do it on this our coding platform, which is Jupyter Notebooks. Again, I want to highlight some resources that we have for you guys. So we have some featured workspaces. So what these featured workspaces are like is like it comes with some pre-built codes which is written. So if you guys want to, let's say if you want to work with Fitbit data and you want some like an intro stuff, okay, how do I pull in the data? What is available? What are the counts? So you can basically click how to work with wearables data, and you can feel free to reuse the codes. This is an open platform. You are completely allowed, and we encourage you all to basically play around with the data with our featured workspaces. Feel free to use the code onto your own platform. Try to familiarize yourself with our data set. Another thing that I really want to highlight is our user support hub. As I said, like our support team is super amazing. And we have some amazing getting started resources, documentation. We also have community forums. So if you want to join our forums, if you have any questions, feel free to pop in your question into our community forums. And if you have any question or if you want to submit any request, it's just like a one-click away. You just click it, write your question, and we are here to answer it. And like as I want to say, like, we have, please follow us on our social media channels. And if you're interested in any specific training session, please contact Ashley Green. She's an amazing lead coordinator at DRC, and she'll help us process your requests. If you need any specific training sessions, or if you're a registered user, you're welcome to come at our new user orientation, or we also have a bi-weekly office hours. You can come to our office hours. There are a lot of resources, and if you have any questions, just email us. We are there to answer your queries. And now I would like to leave this room open to question and answers and discussion.
Well, thank you so much. This is incredibly exciting. I have already several questions, but I would like to open the floor. I'm sure lots of people have questions.
I have a question. Hi, this is Mia. Can you hear me?
Yes.
Okay, great. Well, thank you so much for the presentation. This is very exciting. I'm personally very interested to use this data set. My question is about healthcare providers. As you were explaining, I was searching the website, like the search tool, but when I searched like providers, I couldn't find anything. Is that another level, like for patients who have access to their EHR? For those patients, we can see their healthcare providers?
Yeah, so what happens is participants can join All of Us program either as direct volunteer platform, or they can share it with a specific healthcare provider platform. So right now, we won't be able to see how they are joining the platform to protect participants' privacy. However, if you are interested in knowing, because I know knowing the EHR site is very, very important when conducting a research, you would be able to see the details on by EHR site number. So you would be able to explore how the data is coming for the EHR data by specific sites, and you would be able to control for it in your research analysis.
So would I be able to see their providers? For example, would I be able to see like they went to this family practice, they went to this cardiologist, or we don't have access to that data?
Not that detailed level, but you would just have like a site number 1, 2, 3, 4, 5, 6, just to protect participants' privacy. We won't have like complete details on that, but you would be able to see what data they're providing. So what we do is in the EHR data, we basically map that data using OMOP common data model. So you would be able to see how many participants contributed to conditions data, how many participants contributed to drugs data, how many participants contributed to visits level data. So you'd be able to see all those information, and then we have EHR site number. So maybe that is one way that you can account for it. Again, I'm not trying to say, but you won't be able to get like a details, like whether this data is coming from Vanderbilt University Medical Center healthcare provider. You won't be able to get that level of deep data, but you'll be able to have like site number data.
I see. Thank you.
I think we had questions in the link related to Fitbit. I think Ashley answered the question. Unless Alison, if you want to talk about your question in details.
Hi, yes, can you hear me?
Yes.
Okay, great presentation. This is really interesting. So Dr. Master, I believe you mentioned that there was something about like real-time data in the control tier, the Fitbit data. So I was just wondering, just to make sure that I'm understanding, if you could maybe clarify kind of what that means and how that data, that kind of real-time data in the control tier is different than the registered tier.
Yeah, that's a great question. And so Fitbit data, right now we have Fitbit data as heart rate summary, heart rate intraday, then physical activity summary and physical activity intraday. So in registered tier data, that data is date shifted by random number 1 to 365 in order to protect privacy of participants. And that is consistent with date shifting that we do even with EHR data. However, if you want to do research where time is an important component, so where you want to do like whether the steps in summer is different than steps in winter, like seasonal variations, or where time is a very, very important factor, then there is a Fitbit data and control tier data, which is same data types, which is available in the registered tier data, but in the control tier, those data are not date shifted. So you would get actual. So what is participant steps per day on April 1st, 2022? You would actually get actual data. So that was a main difference between Fitbit data available in registered tier versus control tier.
Thank you very much.
So is there a link to mortality data into the All of Us? Or do you link the records to mortality data also?
I'm sorry, I don't understand.
To mortality, to death information.
Right now, we don't provide that death data to our researchers to protect participants' privacy. However, if you guys want to link any of the data onto your platform, you guys are encouraged. We would only want to ensure that there's no potential risk of re-identification that can happen with the research that you guys are conducting.
I see. And I also have another question. Do you link or are there plans to link All of Us to the N3C registry, the COVID-19 NIH registry?
I'm not sure. Minky, do you have an idea?
I'm just curious, really.
I'm not sure. Minky, do you have an idea?
Yeah, I'm not sure if we have plans to link to any data registries at this point.
But again, if you have a feedback or if you want to share some interesting things that you guys want to see which is missing, feel free to email it, email to our support team, because we are gathering feedback, and if there's any way we can expand our offerings, we then vet all the comments and we vet all the feedback that we get, and then we bring to our leadership, and then we can then discuss the ways, and then we can prioritize the activities. So if you have any thoughts or feedback, please email us at support@researchallofus.org. And again, I'll have Ashley put that email address in the comments, in the chat option.
Any other questions?
Just to reiterate on one of the questions answered by Hiral, death, some concepts about death are suppressed, but we do unsuppress death date as one of them. But the cause of death is suppressed because that's
so
public record. So you would be able to re-identify. So we suppress cause of death, but we do have death date.
Oh, okay. All right. Okay. And so is it possible, once you have, once you are on the workspace, is it possible to load external data to our own workspace?
Yes, you can.
Oh, okay.
I have another question. So I just want to make sure I understand it correctly. So when you say that we can see patients' site, does it mean that we can see in which state they are, or how would we know if? And when you say we can connect it to our data, is there identifiers for patients?
So in the control tier data, we have the data up to 3-level zip code data available. So you guys have that data in control tier. So you guys can do further exploration if need be.
Okay.
Well, I have other questions, so I can keep asking. So the control data, obviously, that's where you have, the dates and more identifiers. So what are the level of security, or not ever, what do you need to do to get access to the control data in addition to the registered tier?
That's a great question. So what happens is when you go onto your researcher workbench, once you finish the registered tier training, then you have an additional set of training to complete for control tier data. And I would first highly encourage, if for University of Delaware, I just have to go back and see if your University of Delaware has signed the control tier access stuff, and then you can click on that. So there's just additional training needed and signing the agreements.
They do have control tier access.
Perfect, great, yeah. So you guys already have the access, so you would just go into your researcher workbench, and when you finish your registered tier training, then you can finish your control tier training, and then sky's the limit. You can decide whether you want to use registered tier or control tier data for your research purpose. One thing I want to let you know is, let's say if you decide to use registered tier data, but halfway through you think that, oh, I want to use control tier data, it is very easy to migrate your code, to migrate all the resources from registered tier to control tier data. It is very easy. Once you're a register and control tier users, you can easily do that. It's simple point and click tools, and you'll be able to migrate your work from register to control tier.
Don't have any other questions. So I'm going on with my questions. I guess all the data are linked for each patient. So the genomic data would be linked to the EHR data, to the survey data for one person, right? Is this correct?
Person ID, yeah. We have like person ID. That would be a common link to connect multiple data streams. You can link so you can connect Fitbit data, demographics data, survey data, genomics data. You can connect like multiple data types by person ID.
I see.
And another question, sorry, Chloe. So we don't need, as researchers, we can work with data ourselves, right? We don't need the data analyst to clean up the data for us, right? Is it easy to use? Okay, great.
Yeah, and like you can, all of us personally, we don't even require IRB approval. Like again, but like confirm with your institution if they require like an exempt IRB, but we personally don't even need IRB approval. It's like we use a data passport model. So if you have a question, jump in, and if you're a registered user, be it registered tier or control tier, I would highly recommend you to jump in onto a researcher workbench platform, create a workspace, and start exploring our data, row level data.
You don't need IRB for any level or for the first level?
No, for any level. Like for any level, like all of us research program, we as DRC and in like the all of us research program as a whole, we don't require you guys don't have to come to us like, okay, can you approve our project? Like there's no such thing. Like we don't have any approvals needed from our end. However, if your institutions, like some institutions require, even if you're doing a secondary analysis of publicly available data set, then they would require you to have an exempt IRB. So if your institution falls under that category, you might need to do an exempt IRB. But again, personally, all of us research program doesn't require an IRB approval.
Oh, I see.
Yeah, and
so it's like a publicly available data set, but with more tools and easier to use, I see. Okay, that's great. Thank you.
Yes, and I would add, we like Hiral said, we don't require an IRB, but we do have a data user code of conduct. And so you can feel free to look at some of our data user code of conduct policies.
And like that, you have to sign in when you become a registered user. So since we would go with the honor system, since you have gone through that research training and you have signed our data use of conduct agreement, so it's like an honor system that you're going to follow all the things like no stigmatization research and all those things. We'll follow all of those things. So that's why we don't require IRB approval.
Yeah. And another question, when a participant signs up to be part of all of us, they can choose if they want to share their information about their providers, or like they can choose like how much they want to share, and they can drop out at any time, right?
Yes, even with the Fitbit data. So let's say if they just want to share steps data, then we'd only get steps data. It's not like we would get all the data. So participants are the deciders. If they want to participate, if they don't want to participate, whatever they say.
Yeah. And do they have to enter it like manually at a certain point, or they can choose whenever they want to enter it? Like what are the intervals for them to contribute? I guess their Fitbit data. Like I don't know how it works with their providers because you get the data from them, but for participants, like if I want to share my Fitbit, how do I do that?
Yeah, so for you to share your Fitbit data right now, you can share it under Bring Your Own Device program. So once you or a participant logs in onto the All of Us Research platform, like join All of Us Research platform, they would then go over all the consent process. then they would consent to share their EHR data. Once they consent to share their EHR data, they would have an option of sharing their own device data. So they can share either their Fitbit data or the Apple device data. So right now we are collecting two data streams, either Fitbit or Apple data.
Oh, I see. Interesting. Thank you.
Yeah.
But for people who agree to share their EHR data, then, I mean, don't you need to have an agreement with a hospital who has the EHR or with the health system, the provider?
Yes, so that's why so we have a list of healthcare providers that have agreed, and we have established that process. So they would be able to share the data via the list of healthcare providers that have agreed to be part of our consortium.
I see.
The data that they share is consistent, right? Like if they agree to participate, they all have to provide certain data. They can pick which one they provide.
Yes, so they have the right to provide whatever data they want to.
Oh, I see. Thank you.
Yeah, to add a little more to that. So the program funds what we call data stewards. So they're in charge of the facilitation of electronic health record data from the hospital or wherever to the program. And that's where the OMOP structure comes into play. So all the data that the health provider collects then gets structured into the OMOP tables via the data steward and then uploaded to the program.
Thank you.
And the data stewards are within the health system or within all of us? Because so basically, if we wanted to provide our information from our EHR, would we have to transform it in OMOP, or are you doing it?
We do it it happens, like you guys don't have to do anything, so it happens on the back end. And like we have contractors, so we have Columbia University, who is another key stakeholder who are basically helping us with this data transformation into using OMOP Common Data Model.
I see.
That also might how you come in through to the program, which pathway you come in through the program is also relevant. If you come in through one of the enrollment partners, which is a healthcare provider, so where you receive your healthcare, then they would have direct access to your EHR and you would just have to consent and then link it. If you come in through the direct volunteer pathway, which is not associated with any particular healthcare provider organization, you have the option of linking your EHR in the participant portal on the All of Us side. And then that will connect the data from your EHR to the program's database.
Any other questions? Well, thank you so much for this wonderful presentation. It was very enlightening, and I'm sure many of our researchers here will have great ideas to use this data. And you're still enrolling, obviously. The goal is to have 1 million people. Is this correct?
Yes. Yes.
So it's still enrolling.
Yes, so we're going to have more
very
participants'
exciting.
data available. So right now we saw like the data is available on 329,000 participants, but definitely those participant numbers are going to grow when we do our next data refresh, which should be sometime in summer. So we basically refresh our data twice a year. So
Okay.
expect to get more data. And again, like every time we do a data refresh, you can basically rerun your analysis by just choosing the most up-to-date data onto your workspace. So you don't have to worry about redoing or like copying your work or any of those things. You just have to do a simple option. Okay, I want to use register tier data version 6, version 7, whatever version is the most latest version.
I see. And you update the data twice a year. This is what you said. Just said.
Yeah, that's our goal, like twice a year.
Well, that sounds great.
Yeah. Just want to say it was so awesome to talk with UD people, like seeing some UD folks. I'm so happy, proud to be a Blue Hand, and looking forward to seeing research coming from Blue Hands and also all other Delaware universities and health systems. So yeah, super happy.
I'm sure we'll have projects. Thank you so much. Thank you for this wonderful presentation. Bye.
Bye.
Thank you. Bye.